can give us your thank you. Before you give us your overview, Sharon, I just, like you to reflect on that sound cloud, that word cloud that came up before. Clearly underfunded, broken, fragmented seem to be the main themes that were emerging, with a whole lot of other issues sitting around that, reflecting similar themes. So, I'd just like to get your reflections on that, and also ask, how much are the problems in the mental health system? How much are they sort of structural, that fragmentation, that siloing that was coming up in that word cloud? And how much are they a function of just sort of underfunding, something that could potentially be addressed through increased resourcing?
Oh, thank you, Jennifer. I think for me, actually looking at that word cloud, there was a lot of words that we're very familiar with, as you said, underfunding, fragmented. The most concerning thing in that word cloud for me was traumatizing. How can we live in a country like Australia and have a health service that people think is traumatizing? Surely it is our absolute first and foremost that we do no harm to people as as people operating and working in the health service. So that for me was the biggest, confronting word. We must do more to invest for the long term in our health system. We have amazing clinicians who are here online and dedicated to actually changing and working together with our politicians, with our health policymakers, with our community to actually develop the solutions for a truly integrated model that's future-proofed. I can't hear you, Jennifer.
Sorry, that was a very important point about traumatizing, and I would absolutely agree that is particularly for a mental health system to be actually involved in increasing trauma experienced by people who have already, experienced trauma in other areas. That's absolutely unacceptable. And thank you for the contribution that the college has made to that debate and to the report, which I think really does highlight so many of those issues and provide some, really quite distressing examples of people's experience. And to give us a little bit more detail about the report and what is happening in New South Wales specifically, I'd like to introduce the chair of the New South Wales branch of the
Before you do that, Jennifer, can I just give you a bit of a sort of overview of some of the sort of national picture and why it's so important that we bring New South Wales to the fore in this?
Yes,
so I too would like to acknowledge the traditional custodians of the land and acknowledge the Gadigal people of the Oro Nation. As the traditional owners of the land, now known as Sydney, I pay my respects to their elders past, present and emerging, and recognise their continuing connection to land, waters and community. As you said, this is National Close the Gap Day, so it feels very timely that we're coming together to have this conversation about the leading cause on and burden of disease in our Aboriginal and First Nations communities. I also want to acknowledge those in our audience today with the lived experience of poor mental health. You know firsthand what needs to change in our health system to enable you to live well and longer. There's never been a more critical time to talk about mental health, globally, nationally, and right here in New South Wales. We've all felt the impact of the pandemic on our mental health. We've all felt that it had an adverse impact on our mental health, but now we have the confronting evidence. A recent survey a global review led by our very own University of Sydney in collaboration with the Australian National University has shown increases in anxiety and depression compared to pre-pandemic levels. So we already had a problem, but it's been exacerbated. Over the past couple of years, we've had numerous inquiries into mental health reform at all levels of government. So what do we know at a system level? We talked about a fragmented system. We talked about a system that really needs to be funded for the longer term. Well, nationally, the Productivity Commission pre-pandemic estimated the cost of mental health, mental illness in this country is a whopping $220 billion a year. Most of us can't even comprehend that size of an impact on our economy. If we look at a state level, the Victorian Royal Commission described their state's mental health system as broken and outlined a 10-year vision for reform with 65 recommendations. All 65 recommendations have been endorsed by the Victorian government. If we look to our colleagues in the north, in Queensland, a recent inquiry in Queensland has resulted in a budget allocation of 1.65 million for mental health over 5 years, funded by a new payroll levy. So this is new money coming into the system. But here we are in our largest state, New South Wales, and it has been tough. Catastrophic bushfires at the end of 2019 rolled into a once-in-a-generational pandemic, through to devastating floods in 2021 and 22, and all this on the backdrop of rising inflation, rising cost of living, and families doing it tough just to keep their roof over their heads. People really are doing it tough here in New South Wales, and the system can't keep pace. There have been enough inquiries and commissions. It's time for action, and we're really glad to bring the community together with those that will put themselves forward to form the next government. We need strong short-term interventions combined with long-term investment in our workforce, our infrastructure, and our mental health services and their design here in New South Wales. We need generational level change. But change at this kind of scale is hard. It takes courage, it takes coordination, and it takes a commitment to long-term investment. Most importantly, it takes leadership and a vision that goes beyond an election cycle. If mental illness is costing our economy $220 billion a year, surely an investment in better mental health is a win for everyone, for our treasurers, state and federal, for our families, for our mental health workforce, and most importantly, for each and every person that has been touched and has a lived experience of mental illness. I'm looking forward to hearing the vision of our candidates here today for what they see as the improvements to our mental health system for the future. And I'm so thankful that you've all come together, and thankful to all of the participants in our report that enabled us to get to this point today. Thank you, Jennifer.
Thank you so much, Sharon, for providing that broad overview and national picture and signalling some of the specific issues in New South Wales that need to be addressed. And I think now to give us a little bit more detail about the on-the-ground situation in New South Wales, I'd like to introduce the New South Wales branch chair of the college, Dr. Angelo Vagona. Dr. Angelo has been a psychiatrist for over 30 years, and he's held senior clinical director appointments with New South Wales Health in rural and metropolitan services. He's been instrumental in establishing early psychosis services and youth mental health services in Campbelltown. And he's going to give us an overview now of the situation in New South Wales and suggest some of the most urgent priorities for change.
Good on you, thanks, Jennifer. And I'm in beautiful Dharawal country down here in the Illawarra. And I'm actually sitting in the hospital when you brought up trauma, Sharon. And this is the first hospital in Australia which is established to treat women suffering from trauma-related disorders. So I didn't finish my CV when they asked me to sort of give them my CV. I stopped at my public sector work, but my private sector work over the last decade has been opening private hospitals, and I've been privileged to be involved in opening private hospitals in Campbelltown and the Illawarra now at Parul. So it has been a big week for us in mental health in New South Wales, and the New South Wales branch of the college and our friends across the sector, this alliance of health, mental health, consumer and carer groups, released a report on the mental health crisis facing New South Wales, as you've all seen. And it was, as you've heard, and Sharon stole so much of my thunder, as a first-hand account of frontline mental health workers, people at the coalface, who described the system really in those terms that you saw in the word cloud, but, a lot of confusion, chaos, and a sense of fiscal neglect, underfunding. Things aren't rosy, obviously, on the front lines, and people are falling through the cracks. That is obvious. It's too hard, too complex, too expensive to get the help you need. We called our report On the Brink because that's what it is, a system which we feel is on the brink of collapse. And before I get into what we want the next Parliament to do about it, I want to thank each of the candidates for turning up here today. Now, we talk about the system being broken, but it was never really a system to begin with. Rather, it's a chaotic multiplicity of systems thrown together by well-intentioned people, thanks to our unique federation, which is one of the problems that we're sort of facing. While the systems are fragmented, the sector is unified. And we're all here looking to you, our candidates, for leadership. We want to work with you. We want you to succeed. And there have been, genuinely good commitments and goals over the last few years. And we acknowledge the initiatives of the Minister, the great new funding for the Safeguards child and adolescent teams, the comprehensive response to the COVID psychological distress, the scaling up and rolling out of a new model of care in headspaces. There was also evidence of a definite shift into Commonwealth realms of responsibility and assigned the state government, who we saw were the heavy lifters during COVID, what they can do, what they can influence. And we see that this is going to be so important going forward in reform in New South Wales. And from Ryan Park in opposition as the health spokesman, we've seen constructive support of the efforts across these issues over the last 4 years. And talking with him in discussions, a genuine interest in these issues. But the system shouldn't have to rely on one minister to get it all done. It simply can't. Mental health is the first casualty when it comes to health funding. Not so long ago, the state's biggest hospital's electricity bill was funded out of the local mental health sector's budget. Our mental health money paying for power bills over the care of people at their most vulnerable. We've got to do better than that. Now, I've been working in the mental health system for 33 years, or the multiplicity of systems, and I've seen a lot. And I know that there are a lot of mental health workers in the audience today, and collectively, a lot of fatigue and frustration, being overworked and under-resourced. But we've also got drive and a lot of optimism, and that we can take some tangible steps to turning the tide. Now, the asks, and we've sort of put those in our releases, are pretty simple. We need the numbers. We want the commitment to a gap analysis, what we have right now and what we should have according to what the models tell us. We know it's bad, but we need to know how bad. And this needs to be made public. And when we're talking about closing the gap today and the federal government having to deliver a closing the gap report, we want a transparent report too on where the gaps are and how big they are and what they're going to be doing to fix them. We need new funding streams, as Sharon mentioned, like Queensland and Victoria, who have led the way with the levy on companies with big payrolls. There's, it's got to be new money. It's not going to come out of incremental stepwise progression from the health budget. It's not going to happen. It's not going to deliver the sorts of results that we need. So we need that large investment. And we also need a task force, really, because none of this, we can have the money, and pump it into the system, but the system needs to be redesigned. We've got to get rid of this multiplicity of systems. We've got to bring things together and integrate them in new ways. We've taken some steps in that in New South Wales already. I think we lead the way in the nation in this regard, but it's going to take strong commitment and leadership to take those next steps. At the end of the day, it's pretty simple. People deserve the right help at the right time. Let's get it done. Thanks.
Fantastic. Thanks, Angelo. Some big picture, practical, short and long-term ideas there for our political leaders, which we'll move on to now to introducing the panel. And I'll just encourage everyone to listen carefully to their responses, because we will be going back to you participants at the end to ask you to rank their responses, a bit like that political worm, if you remember that on the TV screens on election night. And election debates. So if you have any questions too, again, put them in the chat, in the function there in the Q&A section, and we'll get to as many of those as we can after we've heard from our politicians. So I'd first like to introduce the Hon. Bronnie Taylor, MLC. Bronnie is the New South Wales Minister for Women, the Minister for Regional Health and the Minister for Mental Health. She's been a member of the Legislative Council since 2015 and has been Deputy Leader of the New South Wales National Party since 2021. Bronnie has, on the ground, hands-on understanding of the health system, because before she entered politics, she worked as a registered nurse and was also Director of Cancer Services in the Southern New South Wales Local Health District. So some excellent grassroots knowledge there. Over to you, Bronnie.
very much, and thanks for having me. And can I just acknowledge everyone with lived experience that's on this today? Look, I understand it's only 2 minutes and politicians do like to talk, so I'll try and keep that extremely concise because I think you'll be more interested in questions. So I suppose for me, I have been the Minister for Mental Health in New South Wales for the last 4 years, and I came in with a very different approach. As you said, I've got a clinical background, so what I really wanted to do was work with the college and get advice from them on how we could move forward and how we could change things. Obviously, we had a strategic plan for suicide prevention as well, which we came in with and which we have funded and worked through, and that's where we've had great new models turn up, like the Safe Havens in New South Wales, that were actually so successful. We rolled them out into the flood zones as well, and we've had really incredible feedback about that, and we've got some really great data to support that, and it's something we borrowed off Victoria. Obviously, I've had quite a bit the last 4 years with COVID and with our natural disasters that have happened. So one thing that we've really done is embed those positions into our mental health system, instead of having bushfire recovery or flood recovery or COVID sort of workers in our resilience and recovery workers that are permanently based within our LHDs. And I think that's a really big step forward. But I think our main reform change has come from work that actually came out of suggestions from the college, our safeguard teams for youth and adolescent mental health. I'm really pleased to say that a lot of people said, oh, why are you doing that? Those positions will be really hard to fill. How will you do it? But we pushed through, and Dr. Vagona was really keen that we pushed through when we did that. And I'm really happy to say that almost our phase 1 is completely staffed now in those teams. The other thing that we've done is we've really stepped outside our space, and we've put final year students into headspace. Usually states and federal government don't play as well together in those sort of situations, but we did that. We just took the initiative to do it. We knew it had to happen. That's also been extremely well received. We've had a lot more appointments that have gone through, and actually I think that'll be a model that the rest of Australia will look at as well. So I think that's exciting. It worked so well that we're now doing it with our general JMOs, our junior medical officers in our New South Wales bigger health system, and that's been a really positive response as well, to use those final year med students within the system. Obviously, 100 wellbeing and health in reach nurses, and that's something that's really close to me. It was a really difficult policy perspective in terms of pulling that lever. We did. The first independent evaluation has had an extremely positive response in terms of dealing with young people's mental health and wellbeing. Also, with those headspaces about all of those extra sort of consults that have happened, I think that's been really important, because we know that the wait list has really blown out in a lot of those sort of centres. The other thing I'll say, one thing again, the college was really specific with us about when we negotiated the election on my mind, the bilateral with the federal government in terms of mental health and our adult health spaces, was that for the first time ever, we negotiated joint clinical and operational governance. And I think that's really important. And we hadn't seen that we had that in Headspace. And then when we decided to go into that field to actually co-locate, that's actually worked extremely well. We've also partnered with Living Works, and we're really excited about that as well. It's one of the biggest challenges that we've undertaken, to train over 275,000 teachers, community leaders and people in terms of, that first online training. How am I going for time? Because I could keep going.
So if you'd wrap it up, that would be great, so we can get on to everyone else.
But listen, I acknowledge that we have done a lot. I acknowledge there's a lot more to do. And going forward into the next term, what I want to do is, we've done a lot already in terms of that sort of real policy change. But going forward, we have to work on that acute side, and we've got to make the system easier and more accessible to access. That's one of the biggest things that I still hear. And I think that's something that I haven't been able to tackle in my term, but I absolutely want to keep going with that. It's complex, as you all know, but absolutely lots more to do. But I'm really, really pleased with where we've come from and trying new things.
Thank you very much, Bronnie, and thank you for agreeing to stick around and answer questions from participants. That would be great. And I'll just move now to introduce Ryan Park. Ryan is a local member, the Shadow Minister for Health, also Shadow Minister for Mental Health and for the Illawarra and South Coast. Prior to entering New South Wales Parliament, he worked as a high school teacher in the Department of Education as a curriculum advisor, and was then appointed as Deputy Director General for Transport New South Wales. So Ryan, over to you.
Thank you, everybody, and I want to acknowledge the traditional owners on the lands I'm coming from, the same as Angelo, the Dharawal people, and pay my respects to elders past, present, and emerging, and obviously acknowledge those with a lived experience. And I also want to acknowledge the Minister, Bronnie Taylor, and thank her for her efforts in terms of mental health services over the last 4 years. It has been a very, very challenging period. Wherever possible, we have deliberately made a decision to try and support those initiatives that we think work. The last thing I think people with mental health challenges and their families need is bickering from politicians. And that's certainly not the approach that Bronnie has taken. It's certainly not the approach that I've taken. And I say to the college and everyone here, that certainly be my approach going forward. I think there is a number of areas that we need to focus on. I think the importance of doing a gap analysis in terms of services can't be underestimated. One of the things we've committed to is a special commission of inquiry with the powers of a royal permission into the funding of healthcare in New South Wales, including mental health services. And that is particularly important for me because as someone who wants to be the health minister in the next few weeks, then that budget is getting bigger and bigger, and we've got to make sure it's going to where it's needed most. And we can't always just simply say we need more. As Angelo says, we have to have a look at different funding methods to do that, but we also have to look at how we're funding things now and can that be done better. And I think a gap analysis running in parallel to that would be a really important opportunity to transparently show the community, healthcare workers, those in the system, those providers in the system, exactly where the gaps are and where the gaps are not, and where those important fills need to be. I think, and I've said this on multiple times, I think the focus for the next health minister and mental health minister will have to be on staffing and how we appropriately staff particularly our acute services, but also across the community sector. That means looking at ways in which we can incentivise staff back into the system. It means looking at ways in which we can support staff who are in the system, and it's looking at ways in which we can encourage new starters to come into the system. Those three things will have to be a priority, I think, whoever forms government in a little over a week's time, particularly in the mental health space. I've had the opportunity to speak to Angelo and others on a number of occasions, and they've emphasised that as being extremely important. I think the other thing that we've probably got to acknowledge is a large piece of work has been done in this space in Victoria. And I think one of the first priorities has to be sitting with the Victorian Health Minister and the government, looking at what they can do and see what we can do up here to make that better. I don't think we should just be running around investigating things that perhaps we already know essentially works and don't work, particularly around funding community health and the importance of funding community health. And I think the Victorian model is a pathway, obviously can't be replicated necessarily exactly in New South Wales, but a certain pathway for a next government going forward in terms of properly resourcing our health system, but in particular, our mental health system. I hope that was under 2 minutes.
Just about. Thanks, Ryan. And I think it's the first time I've ever heard a New South Wales politician admit they can learn something from Victoria. So that's one for the books. I'd like to move on now to the upper house candidate, Ms. Alison Waters. So Alison is standing for the Animal Justice Party. She's been a social worker for over 20 years and is an advocate for women, children and animals experiencing family and domestic violence. And Alison is joining us today from Lismore, I believe.
Correct. Thanks, Jennifer. Hi, everyone. I'm Alison. I live on Widjabul Waiable country, and I would like to pay respect to elders past, present and emerging. The Animal Justice Party supports a mental health system that's fully funded, accessible to everyone who needs it and meets the needs of the community. As a party, we recognise the important role that companion animals play in providing unconditional love, companionship, stability and the facilitation of social interaction. As a social worker, I know firsthand that the human-animal bond promotes positive mental health, and this bond can be vital for a person's well-being during times of crisis, such as for women and children who are experiencing domestic and family violence, and also in their recovery. I have worked in Lismore for over 20 years in the domestic and family violence sector, and in this role, I am acutely aware that mental health services in regional areas are underfunded and inaccessible. Sometimes people have to travel out of area. In our case, people are traveling over the border to Queensland to access the services that they need. Wait times are lengthy, or books may be closed. You all probably know that Lismore is a town in recovery, and we know the importance of providing accessible and long-term mental health support to communities impacted by disasters. And that is clear from the Black Saturday bushfires 10-year research. There are people in Lismore who are reaching out to mental health services for the first time in their lives, people who were rescued from their ceiling cavities, the people who rescued them, people who saw their animals drown, and for people who feel like their sense of security and well-being and their daily routine has been ripped out from under them. And we need those services to be there for them, for all of us, for the long term. Most of the clients that I've worked with could not afford to pay for mental health services, and they were reliant on government-funded services, which also had long wait lists and limited availability in some towns. So, like the Victim Services Scheme. It's clear from the report of frontline staff that urgent reform and significant investment is required in the New South Wales mental health system. Animal Justice Party MP Emma Hurst was Deputy Chair of the Health Committee and has a background in psychology. So as a team, mental health is a huge priority for both of us. In fact, after reading the report, we believe an upper house inquiry is necessary. It is critical that we examine regional and rural mental health and also determine how much funding is required given all of the aspects raised by frontline workers. Also, with an inquiry, the hope is that all parties will recognise the necessity for urgent reform and we can cement the increase in funding and support that is desperately required. I can assure you that Emma Hurst and I are committed to ensuring that mental health is a policy priority for the next New South Wales Parliament. Thank you.
Thank you very much, Alison. Very useful. And just a reminder to everyone that you can put questions for our political panelists in the Q&A section over there. We're great. We've got some questions coming in, but we're also interested in more. Now I'd like to move over to Mrs. Helen Dalton, who is the independent member for Murray, a rural New South Wales electorate of over 100,000 square kilometres. Prior to being elected in 2019, Helen was a teacher and a farmer. She's passionate about fair and equitable access of rural communities to health and education services. So Helen, over to you.
Yeah, sorry, just having a bit of trouble there. Yeah, thank you. I'd also like to acknowledge past, present, or the traditional owners, past, present and emerging. So I'm coming to you from Wiradjuri country. So there you go. So I know in 2 minutes I've got to get through quite a lot. So for me, yes, we have a massive problem in my electorate, and it is the second biggest electorate. So and of course we are rural, so we don't have regional hospitals, we have rural hospitals. We completed a mental health paper in Griffith in 2022, trying to work out how we can navigate through the system and what we need to do. So we spoke to many mental health experts, psychologists, parents and young people. The suicide rates in Murrumbidgee are more than twice as high as Sydney, and this is incredibly concerning. And prior to 2010, we were on a par from Sydney. So a lot's happened in those years, those 12 years. So that equates to about 16.2 people per 100,000. There is not one single designated mental health unit in any hospital in Murray. And that means that we've got to travel either interstate, into Victoria, or to larger regional areas. And often these places are overcommitted, and often people are languishing there and sent home. We certainly have difficulty in accessing mental health treatment in Murrumbidgee. Hard to find any Medicare help, and difficult for ongoing support as well. People have to, as I said, travel outside our electorate, away from their friends and family, and for the Indigenous, going off country is very, very difficult. And it's well, that's for First Nations, and of course it's difficult for anyone really because they're away from their support network. There are a number of excellent health professionals who are working excessive hours and often underpaid. We've had people leaving the service, job in psychiatry, psychologists at schools because they have been underpaid. and they refuse to be underpaid, which I don't blame them, and they move to a job which pays more. So it's about money as well. The schools are not properly resourced, and I'm finding that there's a lot of problems in primary schools and TAFE as well as high schools. We were promised 2 counsellors in the last election, and none of that in high schools, and none of that has been delivered. Between 2015 and 2020, there are 182 patients which were transferred from Griffith to Wagga to the mental care unit. Often have to, and they go there and they often have to find their way home at their own expense. Some of the solutions we think, we're certainly starting with this Big Brother, Big Sister mentoring program, trying to get that off the ground in Griffith. We need an increase in Medicare rebate for mental health professionals in rural areas. We need to build medical training hubs in rural areas to encourage practitioners to stay after completing their qualifications. And often practitioners have to move or travel or go to Sydney or other areas to get training, and it's just too hard. So we need to make sure that our rural areas have these training hubs. We need to reduce university debts for people who choose to study in rural areas. We need, as I said, to increase pay for health professionals in permanent positions to encourage people to stay. We have a Griffith-based psychologist, Catherine Munro, said she constantly gets calls from people wanting an appointment, but she just can't fit them in. So we are really I suppose, under-resourced for the amount of people that we need, that need assistance. We tend to have clusters. We had a cluster of 5 adolescent boys one summer, which is just devastating. I think 4 out of the 5 were in First Nations people. And we had another cluster, about 4 or 5 across the area, mostly of girls, adolescent girls. It is terrible. Of late, it hasn't been too bad. I think coming out of COVID has reinvigorated people's spirits, but it's still a huge problem. And also with farming men, at times too, we have quite a lot of that. And of course, a lot of it goes not reported. So it is a heck of a problem in my seat. So we need hospitals. We're building a hospital now in Griffith, and we want a dedicated mental health unit, not just a, not just a little room. We really need assistance in all of that. And I'll try and keep pushing. I'll be speaking to both the Coalition and Labor, and I have over the years on these issues. So I guess we'll continue to do so. The other thing that we really do need a drug and alcohol rehab in Griffith, and that's about my bit. It's a massive problem.
Thank you, Helen, specifically for highlighting some of those really urgent needs in rural and regional Australia, which can be, different and even more urgent than those happening in urban areas. And finally, I'd like to move to Dr. Amanda Cohen from the Greens. Amanda is an Upper House Greens candidate for the upcoming New South Wales election. She's a rural GP and also a frontline emergency services volunteer. She's based in the Albury-Wodonga region. She's been responsible for driving regional coordination to support victim survivors of family violence in her role as chair of the Border Domestic Violence Network. Welcome, Amanda.
Thanks so much. And of course, I should acknowledge that I'm on Wiradjuri land tonight that was stolen and never ceded. I acknowledge elders past and present, as well as the ongoing impact of colonisation as a social determinant of mental health. As the people with lived experience who are joining us tonight would know, what we have at the moment is actually not a system. If we had to design a system to care for people today, it would not look like what we have now. And as a GP, I know that public services are so under-resourced that they can only help people who are imminently going to harm themselves or others. It doesn't help my patients to give them a piece of paper and the onus on them to ring around various private psychology services or not-for-profit organisations to find someone with capacity to take them on, and then having to repeat their stories over and over again until they give up and turn up in an emergency department one day. Here in Albury-Wodonga, we have a supposedly 24/7 mental health access line that goes to voicemail more often than not. This week in the media, we saw Joel McKay's really courageous testimony about what his experience was like with an unacceptable wait time of several hours in an emergency department. And I was quite horrified and embarrassed that my own personal response to read that story was, gosh, he only waited a few hours. Because I've worked in rural emergency departments, including in Helen's electorate of Murray, where people have languished for days waiting for actual mental health treatment. And there's been talk about doing gap analysis tonight, but we shouldn't need to wait for that to happen when we already know that here in New South Wales, per capita spending on community mental health services is the lowest of any state or territory in Australia. The Greens support nurse to patient ratios in acute facilities, but we actually need to make the investment to keep people well and out of hospital. And for the majority of people, hospital is not necessarily a place of healing for them, and we need to be able to support people within their own communities. Now, in terms of community mental health services, not everyone actually needs a psychologist or a psychiatrist. And a properly resourced multidisciplinary service means patients get exactly the service that they need, whether that's a counsellor or a social worker or a GP or a psychologist or a psychiatrist. And that model not only improves care for patients, but working conditions for clinicians as well, who suffer extraordinary vicarious trauma and benefit from working in teams. We've talked a little bit tonight about Victoria's Royal Commission, which set out a 10-year vision, including a new Mental Health and Wellbeing Act, establishing an integrated mental health and wellbeing system and a record $3.8 billion in funding. That is the kind of systemic overhaul that we need in New South Wales, not single issue investment in more siloed and fragmented programs. And finally, I know we're running out of time, but we have to address the social and environmental determinants of mental health. Clinicians cannot support people's mental health, particularly while they're in insecure housing, and we need significant investment in public and social housing to reduce those wait lists. Thanks.
Thank you very much, Amanda. And we're just going to some questions now from panel members, and I'll go back to the Minister, Bronnie Taylor, first, and then to Ryan Park to address some of those questions. We've had a number of questions from participants highlighting the mental health impacts of climate change and specifically asking whether they will be addressed in the future government or potential government's planning on mental health, and in particular around heatwave planning, that it will include a mental health component. So Bronnie and then Ryan, would you like to respond to that question?
Sure, absolutely, of course. Look, all of the determinants that cause mental ill health will absolutely, are absolutely considered and absolutely thought of. And, this has been raised, it's been raised with me in question time, actually, by Kate Fairman, who's one of the members of the Greens, about climate change and its effect on mental ill health. And absolutely all of those things are considered and factored in.
Thank you. And Ryan, do you have a response to that?
Yeah, I think what Bronnie said is right. The reality is climate change means we're going to have more challenging weather conditions going forward, and we can't just do the same. What we have to do is have some inbuilt mechanisms into these crisis and recovery plans so that people can not only get their house back in order or their caravan back in order or their possessions back in order, but they can also get their mental health wellbeing back in order. And I think some of the challenges and what we've learned from Lismore needs to be captured so we don't reinvent the wheel again. We actually learn from these instances because we know they're going to be more frequent, and actually put in place the systems as a part of the crisis recovery that deals with people's mental health support. I think that has to be a crucial way of planning for natural disasters going forward, because we all know, well, those of us who accept the science know, that there's going to be more of these type of weather patterns causing these types of issues across the community.
Thanks, Ryan. And just sticking with you for a minute, we've also had a number of questions about funding for mental health. We saw in the word cloud earlier that underfunded was one of the strongest words coming up. We heard from Sharon about the incredible cost of mental ill health on the New South Wales community and how disproportionate that is to the money spent on mental health services. So if you could just respond to a question in relation to funding. So do you have a percentage of the health budget or a quantum that you can commit to investing into mental health care? And also, could you reflect on why it is so difficult for ministers for health, ministers for mental health to convince treasurers to invest more money in mental health when clearly the costs of that to the community are much greater than, you know, the amount of money that's being asked to invest in services?
Yeah, well, we haven't said that we would increase it more than what the government has allocated already. So I can say that at this stage. Obviously, there's a little bit of time left in the campaign, but I can give you that response at the moment. One of the reasons why I'm going to be pushing ahead with the Special Commission of Inquiry into health funding is because I do believe there's an opportunity to better fund mental health going forward. Angelo has talked about the Victorian model and using a taxation system to do that. We're not there at this stage. Our side of politics is not there. I don't think Bronnie's side of politics is there at this stage. What we've committed to, though, is an inquiry that's got the powers of a Royal Commission to have a look at exactly where we're spending the health dollar, where we can allocate it better, where we're spending the mental health dollar, where there's gaps, which is why I'm particularly keen to have a look at a gap analysis that runs parallel to that to identify where those gaps are and how we can better fund those particular areas, parts of the system, or geographical parts of the system, which is sometimes the case with certain LHDs are certainly overrepresented at times.
Thanks, Ryan. And Bronnie, do you have a response to that question?
Yeah, sure. Look, I know since I've become the mental health minister, we've increased that mental health budget by about 50%. So I think that's significant. And I will say as well, and it's when you're comparing health budgets. So when we look at things, so Victoria encapsulates all of their things into their funding spend. So everything's spelled in education and emergency services and forensics, all into that budget, and we keep that separate. So there's about an extra $1 billion that's spent on all that. But look, I don't think we're interested in money and amounts. It's actually services and how those services are working for people. And I agree, we have to keep looking at that. And look, if I had my way, I'd want a whole budget for my portfolio. So, you get like that, and you really, you work really hard towards that. And obviously we're entering into a phase where there are, the economy is in a serious situation, and there are things that have to make decisions that have to be made. But I think what we also need to do is we need to look at how we do things better, and how it's a very different system to what it was. And I think that, one of the things that we've seen with telehealth working is that really in the mental health space, psychiatrists have done an incredible job. They've actually done it really well, and probably the best in the health system. So I think we have to keep looking at how that evolves and how we do things differently. And basically, if people are saying what they're saying and consumers are saying that, then we've got to do better, and we've got to keep looking at that in a different way. But I think as well, we have had that increase, and when you look at the spend, it's not like for like in terms of how that's worked out. And our HASI program is extremely successful in New South Wales. It's amazing. It's very costly, but very effective. But that's also not included in that spend. So I think, you've got to look at like for like as well. But I completely take on board, more needs to be done. We need to do things differently. The system's evolved. I think too, what it was said as well about that entry point into the system is really, it's clunky and it's not working like it should, and we have to do better with that. And that's definitely on my radar.
Great, thank you for that. We've also had a number of questions about the mental health workforce, and that was one of the themes in the report, which did reveal that the health workforce is stressed, under pressure, burnt out at all levels. And we've had a couple of questions asking around, are political leaders aware of the stress that the workforce is under? Are you making any specific commitments in relation to increasing workforce numbers, taking the pressure off the health workforce, or anything else that will support the mental health workers out there in the field? Bronnie first.
Thank you for that. And look, absolutely, what everyone's been through has just been, I'm a registered nurse myself. I'm not a registered mental health nurse, but the pressure's been incredible, and we know that, and that's been really difficult, and the system has come through a really difficult time. And I think when you look at all of those natural disasters that happened, and I'm acutely aware of it, we lost one of our farms over at Adelong. We were completely burnt out 2 days before New Year's Day. Like it is really difficult, and everybody deals with that in different ways. But I think that it is really stressful. There's been a lot of trauma, as was mentioned as well before, and I think we need to get better at that, and we need to get better at distinguishing that trauma response as well. I think we have learnt a lot in terms of disaster recovery and what we need to do, but we do need to look after our people. They're our greatest asset. And, you know, as a clinician myself and as someone that has, you know, many, many friends in the health system, it's distressing to hear that people are distressed and that those sort of situations are occurring. And I think we are seeing, you know, as we come out of COVID, as we have come out of COVID, I'm hoping that those pressures will lift as well and help that general circumstance as we feel there's more positivity across the regions. You know, I think that will help. I think that when we look in New South Wales and we look at rates of, say, regional youth suicide that were mentioned before, we've had a 60% reduction in regional youth suicide over these last 4 years. I mean, that's not me as the minister, that's all of the people out there doing an incredible job under very, very difficult circumstances. So yes, we need to look after our people. Yes, we need to take those stressors off. But I think really when you look at the last couple of years and the pressure that the system's been under, it's coped incredibly well. Are people tired? Yes. Are they exhausted? Yes. Are they fatigued? Are they frustrated? Absolutely. And I'm really keen to work through all that. It matters to me. I'm one of them. I spent my career in health. And we have to keep working through that. But this really has been, I don't mean to use the word unprecedented, but I don't know how you describe otherwise the last few years and what's happened.
Thanks, Bronnie. And Ryan, do you have anything to add that Labor is going to commit to in relation to the mental health workforce?
Well, without a doubt. I mean, it's the biggest challenge that the next health minister will face in terms of staffing. We've made a number of commitments for nurses, an additional 1,200 on top of what the government's committed, and starting to reform the way in which they're staffed within hospitals, moving to a much more shift-by-shift focus, starting in our emergency departments and general wards, and then moving throughout other parts of the hospital. This reform will take time. We've never said it'll happen overnight. We've also put in place into the system some incentives for those currently undertaking their training, including undertaking mental health. So that'll mean $4,000 per year over 3 years for 2,000 places in terms of providing some direct incentives to those in the pipeline that we're going to need to make sure are put in place and are part of the health workforce going forward, a health workforce that will continue to be under enormous demand. We've also taken the decision that we want to scrap the wages cap so that we can sit down with the workforce and have a meaningful discussion around productivity and wages without a blunt instrument, essentially stopping all of that and stopping the innovation from the workforce, and then stopping the government sharing the benefits that productivity changes have back to the workforce. So I think Bronnie would agree. I've certainly been saying it for a long time. It will be without a doubt the single biggest challenge facing the next parliament, which is staffing of the health, but including the mental health sector right across New South Wales. It's not going to happen immediately, and anyone who tells you that they've got all the solutions like that is just not being upfront and telling you the truth. To be brutally honest, the strain has been real over the last 3 years. It's been acute. We are losing people, and we need to try and stem that, but also at the same time provide a pipeline for people to come into the workforce as well.
Fabulous. Thanks, Ryan. And if I could just keep going with another question to you. We've had a couple of questions coming in about the importance of housing, picking up on the point made by Dr. Amanda Cohen about housing as a determinant of mental health, specifically asking if you have any plans to work across the housing portfolio to address housing security issues, in particular for people at risk or experiencing mental ill health.
Yeah, one of the things that we've actually announced recently that I was really proud to have advocated for with our housing spokesperson, Rose Jackson, is $20 million up through the Haven Foundation that will be providing special and specific housing developments to those people with mental illness and psychological disability to be able to stable long-term housing and vital support services wrapped around that. What we do know is that is a start, it's not a finish. What we do know is that when people have stable housing, a lot of the other issues that they're dealing with can start to be navigated and worked on. So of course, it is going to have to be a priority. The Minister, I think, mentioned HASI. It's a very strong and successful program, without a doubt. I think one of the things that I'll be looking at, if given the privilege, is how we can do more in that space. I think it's really a strong and successful program, one that clearly the sector, and I've spoken to many people within the sector, have told me is important and is an important one to look at doing more in that space. And I think regardless of who's in power in a little over a week's time, those sort of programs and funding for those programs are going to have to be a priority for the next government's first budget.
Thanks, Ryan. I'll just go back to the Minister and ask Bronnie, do you have anything to add there in relation to your government's commitments for housing and mental health issues?
Look, and thanks, Ryan, again. I really do enjoy working with Ryan, but as well, obviously, HASI is something that the New South Wales government made sure that we kept as well. Other states actually let that go with the NDIS, so I'm really pleased we kept that. It is successful. Another model we're trying is the Habless model, which I actually went to Melbourne to see, which was actually Alan Fells got me to have a look at that, and we're in a joint partnership at the moment with a development in Sydney of units to do that, to allow people that are living with a mental illness to have wraparound supports and all of that. So I'm really keen to see, I think it's going to be a real game changer. That it's worked really well in Victoria as well. So we're doing that. So that's just one of the things that we're doing as well. And in terms of health workforce, one thing we're doing as well in housing and accommodation is we've got a very big program with rolling out accommodation on hospital sites for health workers as well. And that's mental health workers. And we've had a lot of success with that as well. So that's just another part of it.
Thanks very much, Minister. If I could just get you to answer one last question, that would be fantastic. We have talked quite a lot about youth mental health, but we have some very specific questions just highlighting the fact that there is increasing need among children and young people for mental health services, that need is not being met. And in particular, one participant has highlighted the need for early psychosis services, which they say are grossly underfunded at the moment. So I just wanted to see if you were aware of that growing need and had any specific commitments or thoughts that you'd like to give participants on that issue.
Yeah, thank you. And I welcome that question. And that, as I said in my earlier intro, that's something that we highlighted about 2 years ago. And we went to the college for advice and said, what can we do to make this space better, to make it more specialised? And that's why we have those safeguard teams, which are multidisciplinary teams that exist within all of the LHDs that have all of those professions that were spoken about before. That's so important to have that approach. And that's why we did it specific youth and mental health teams. Now, the evidence coming out of those teams that are operating at the moment is extremely positive in terms of the fact where you've had people that have made constant presentations to the emergency department, which is not right for them and not the system that we want, are actually being able to be managed by these teams that can go into your home, can go into the emergency department, can go into your school. That is youth specific that we've done and that we keep to roll out. But what was important about that as well is it's a signal from the government saying, we are going to fund these teams. We want them going forward. And these are big career pathways as a youth specialty. So that's what we're doing. And also obviously Headspace as well, putting those final year graduate students, which I mentioned before. I think we've had over 20,000 consults. I'll just have to double check that, but I'm pretty sure that's the case. It's actually 40,000 consults as well in those Headspace areas. And speaking to the final year students that have been in there and seeing the benefit to them. Again, that was worked out with the college as well. So that's been my approach, and that's where I've been really youth specific. But I will say again too, that rate of, we do keep suicide data. That's what we have done for the last few years in New South Wales so that we can track that. And as I say again, that reduction, 60% in regional youth suicide is, and I've said to my mental health branch, we need to find out what we've done that's working there, that's pulling that back down, because that's something we really want to harness. And it's really, really assuring to be able to see that you're getting some of those, decreases. Obviously, any death to suicide is a complete tragedy, but to see that happening and coinciding with policy direction in terms of, say, a regional youth portfolio, as now there's a regional health portfolio, I think has demonstrated some incredible results so far.
Thank you very much, Minister. Ryan, do you have anything to add from Labor's side on youth mental health?
Look, we've, initial commitment around Kids Helpline and making sure that that service is properly resourced. But having a background in health and phys ed and in an education setting, what we need to do is try and make sure that what we're providing at school as an early intervention is a part of the mix. I think governments of the past have got it of all political persuasions, haven't focused there, and we haven't provided teachers with the support or students and their parents with an opportunity to access proper, high quality mental health services through their school. To be able to navigate a complex system is not always possible. I can assure you, as a local member, this issue comes up with me time and time again, and that is the challenges to access the system for young people, both the financial challenges and simply navigating it. And I think schools play not the whole role, but an important part in that space, as do the community health providers right across our system. So I think both of those stages are important, particularly for young people, making sure that we find out where and how they're navigating and how they're accessing their support, and then ensuring that we've got systems in place that support that.
Thank you very much, Ryan. And now that we've heard from our politicians, it would be great to get participants' views on, tell us what you thought about the panel members' responses. So if we go back to the interactive tool, the link's in the comments, the QR code I think will be coming up on the screen. And we're asking everyone on a scale of 1 to 5, with 1 being terrible, 5 being brilliant, to rate the responses from each of our politicians. So that QR code is coming up now. That will give us a little bit of a poll, a worm. I'm not sure how rigorous it is, how predictive it is, but it's certainly, we've had a good attendance tonight, and it's certainly people who are passionate about mental health. So it will be a useful data point, at least from people that are engaged in the mental health sector. So here we go, it's coming up now. Well, everyone's doing reasonably well. I think Dr. Amanda Cohn looks like she's the front runner at this point, but certainly everyone has, scoring pretty well on that. That very strange 4-pronged, 5-pronged worm there. So keep putting in your views, and it will be interesting to see if they're reflected in the election results. So anyway, thank you very much for coming tonight. Thanks to the participants. Thank you especially to our political panels, in particular the Minister Bronnie Taylor, Shadow Minister Ryan Park, for being so generous with your time and responding to those questions. These sorts of forums are so very important for the mental health sector, to hear directly from political leaders about their views that will help inform how they vote and how they talk to their colleagues across the mental health sector about the very important decision that they will be making at the upcoming election. We didn't get to everyone's questions, but we got through to most of them. We did have a lot coming through, but we have made a note of them, and we'll try and get answers to those outstanding questions to participants later. Thank you again, everyone, for participating on this very important forum tonight, and let's hope whatever the outcome is of the upcoming election, that it's the start of a better mental health system for the people of New South Wales. Thank you very much.